Ready.
Hi, my name is Mandeep Kaur Bhatia. I am a practical nurse learner. Here is my Boveli card. You can see from the front and the back. My ID number is 402940. I'm going to read the assessment scenario. I am a practical nurse learner caring for Mrs. Shirley Smith. 10 days ago, she presented to the emergency department stating that she was experiencing severe upper right quadrant abdominal pain. She underwent an emergency open cholecystectomy and then was admitted to the gastrointestinal surgical unit. She developed an infection and therefore had a prolonged hospital stay. Today she will be going home once you remove her staples. Now the doctor order. MRN 125-2569, room 352, patient Smith Shirley, date of birth 1985-27, sex female, physician Sparks Gregory. Admission diagnosis: severe upper right quadrant abdominal pain, emergency open cholecystectomy, medical history C-section 2018, allergies, no known allergies, weight 81 kg, goal of care designation R1. Today date is 6 October 2020, time 1100. Remove all staples, apply steri strips and cover with sterile dressing. Discharge home. Clean abdominal incision with normal saline and apply sterile dressing. There, as you see, my doctor's order from the front, my assessment, and from the back. So now I'm going to show my all supplies which I need for the procedure. This is my blue drape, putting the extra things on it, and my garbage bag, my ruler for assessing the wound, for measuring the wound, and my hand sanitizer, my gloves, my cavi wipes, and this is a normal saline. So if it's open, it can be used after 24 hours, and everything is written on the bottle, but this is the new one. And now I have to 3 checks according to the doctor order. So first check is Smith Shirley normal saline 20 December 2021. Second check Smith Shirley normal saline 20 December 2021. Third check Smith Shirley normal saline expiry date 20 December 2021. So this is good to go. So now I have my steri strips. It is intact, dry and not ripped, and expiry date 20 December 2021. And my staple removal kit, it is intact, dry and not ripped, and expiry date 3 July 2022. And my tape for closing the wound, and I have some extra gauze 4x4 and 2x2 in case of any extra drainage or blood. So, and my dressing tray. So this is intact, not ripped. It has no expiry because it is come in the bundle. So now, before entering the patient room, I have to hand cleaning with sanitizer for 30 seconds, front, back, around the thumbs, and wait for until dry. So now I'm going to show all my the environment for safety check, and I'm in the right room, room number 352. Hi, Mrs. Smith. How are you today? Good. I am a Mandeep Kaur Bhatia. I am a practical nurse learner. Here I am coming for your dressing change and staple removal. Everything is good. Can you spell your first name, please? She said Shirley. And can you spell your last name, please? She said Smith. And date of birth 1985 March 27. Okay. Can I match your ID band with my orders, please? So here, Smith Shirley, name, hospital 120, number 125-2569, and date of birth 1985 March 27. Thanks a lot. So now I have few questions for you, Mrs. Smith. Do you have any allergies for the latex or any other allergy? She said no, I'm good. Do you have any pain right now? Or I can bring I also bring some analgesics with me. No, she said she don't have any pain. So you want to go to the washroom? It will take 30 minutes to complete the procedure. She said no, I'm good. Okay, thank you. So now I'm applying brake 4 sides of the bed, second and third and fourth. So now I'm putting the rails up from the opposite side of the patient, and I'm going to up the bed up to my waist level according to the sterile procedure, and the curtains privacy on. Now again hand hygiene for 30 seconds. Now I'm going to expose the patient wound so that I can carry my procedure. And there is my blue drape. So would you mind, Mrs. Smith, if I put my drape on the parallel of your side? She said no, I wouldn't mind. Thank you. Now again, now I have extra garbage bag to avoid the mess. I'm going to attach it with my table. So there's my garbage bag. So now again, hand hygiene for 30 seconds until dry. So before going to the patient, before doing any procedure with the patient, I have to wear my gloves to avoid the infection and contamination. So Mrs. Smith, are you ready for the procedure? She said yes. I'm going to remove the dressing of the patient away from the patient vision. So this is my dressing and I'm removing it away from the patient vision. And as you see, this dressing is clear. There is no drainage. So I can assess taco, and there is no type actually because it is no purulent and sanguous amount, color and order. Everything is good. So now I'm going to remove this dressing. I'm going to garbage this with my gloves. So, and the second one is from the inner side, and put it in the garbage. Again, hand hygiene for 30 seconds until dry. Now as you see, if I assess the radar, there is no redness, no edema, no ecchymosis, approximation is good and no drainage. Now I'm going to measure the wound with the approximation without touching the skin. So this is around about 6 inches. So this is, I think, well approximated. So again, hand hygiene. And now as you see, there are 8 staples, and according to doctor, I have to remove all staples, but now I'm going there. We are doing practice or practical. So there I just remove the 3 staples out of 8 and alternatively. And the next step, now I'm going again, hand hygiene, and going to wear the gloves for clean my table. As my table is not up to the waist level, but it should be up to the waist level according to sterility principle. But I have no such arrangement, so this is not to the waist level. So now I wipe my table, I clean my table with Cavi wipes. So let it be dry for a second, and now I'm remove my gloves. Put it in the garbage. Again, hand hygiene for 30 seconds. Now my table ready for the sterile field. Now I'm putting some supplies. This is my gloves and my hand sanitizer and tape and some extra gauze pieces and normal saline, my staple removal kit. And now again I'm starting to maintain sterile field. So again, hand hygiene for 30 seconds until dry. Now I grab my tray from the inner side, avoid the edges as you see. So now I'm peeling this wrap towards me in order to avoid the cross contamination, and put it in the garbage. And so I let it place on the table, and there is a green forceps. I take it from the side and I take first drape and going backward, and the shiny part down, place on the table, Then again, I don't need the second drape, so I put it on the side. Now there are two forceps and I have to put on the sterile field, actually on the sides of the sterile field. So going backward, put it on the side, centimeters, and the second forcep going backward without crossing field, put it on the side, and my green forcep, I put it on the side. So here, and I remain my 4x4 gauze on the tray, and now I'm going to clean the wound. Before cleaning the wound, I'm putting the normal saline without crossing my field. So that as I 3 checks with the normal saline, I take off the lid and I lip off some of the normal saline in the garbage. And now I'm going to put on the tray without touching. So now I'm going to put some normal saline on my 2x2 gauze and coming back without crossing field, place my normal saline. Again, hand hygiene for 30 seconds. Now I take my two forceps to pick the 2x2 gauze to clean the wound. The first one and the second one. I'm avoiding to cross contamination. Now I'm making the pillow 2x2 gauze, and now I'm going to clean the wound. So I'm going to clean from clean to dry dirty part, that is from top to bottom. So now I'm putting my forceps downward position because according to sterility principle, so these are the wet, so to avoid contamination it should be pointed downward. So now I'm going to start to clean from the center part and place it on the side. Now the second, I'm making the pillow, second gauze. Now I'm cleaning the farthest part from top to bottom, clean to dirty, and place it on the side. And now the next is again making a pillow, and I am now cleaning the closest part from top to bottom and place it on the side. So now I don't need any forceps more because they are wet and they are contaminated. I place it on the side. So as you see, my wound is now cleaning perfectly. The edges are closed and there is no redness. And now let it be dry, air dry for a second so that I can remove my staples. Now the next step is wash my hands, sanitize my hand with hand sanitizer for 30 seconds. And I'm going to put my gloves. I'm constantly contact eye with my field. I'm going to wear the gloves for the staple removal. So now I took this staple removal kit without crossing my field, and I have to peel like a banana and take it from the top without touching the inner ends, and garbage on the side. Now as you see, underneath there are 2 teeth underneath, and I'm going to, now there are, as I already told, there are 8 staples. So for the practice purpose, I have to remove the 3 alternative staple without first and last. So I form the second one from the inner side, closes inner side, and gently remove the staple and put it on the side. Now the fourth one, form from the underneath, tuck it, gently remove and put it on the side. As I have to count the staples, so I put it on all the sides. Now the last one is alternative, the third one, last one. So there are remaining 5 staples. I didn't remove. So now I remove 3 staples and 5 are left. So I don't need these staple removal long. So now I'm going to put this one on the side. So now I'm going to put steri strip on the staple removal side. So there is my strip, Paris strip here. So sorry, steri strip here. So I peel it like a banana. So take it off from the cover and put it on the garbage. And now I'm going to take off first Paris strips and put it on the first staple removal without touching the inner part, as you see. And now the second one, take it off and put it on the without touching any other part. And the third one, I don't need that cover, so take it off and the sorry so here these are I put my steri strips. Now there is done, I have to put the gauze over the steri strip. Now I didn't cross my field, so I have my green forceps left, so I put from the side and going back and take my 4x4 gauze from the tray and put it on the top of the wound. So, and I don't need any more, so now I put on the side. Now next step is to taping. So I take the tape from the table and I have to tape from the 4 sides. First side, then second, then third, then fourth. Now I'm going to write my time, date and initials on one other tape. Here I have a pen. I'm going to write time 11, date 6 October 2020 and my initials. Now this tape also I apply on one side of the wound. So this is almost all done, and now I'm going to take all supplies with my gloves in order to avoid contamination. So it has a sharp blades and other sharp things, so I have to take in the biohazard bin. So with my gloves I took all the in the biohazard bin, and I took all the supplies here also, my drape and my tray, my table. So So are you okay, Mrs. Smith? She said I'm absolutely okay. So I'm going to remove the gloves without touching, and from the side, and put it in the garbage. Hand hygiene for a second. So how are you feeling, Mrs. Smith? She said I'm good, no pain. Okay, so I have to give you 3 teaching. So I'm going to cover your wound first. So first is when you go to the shower, make sure you put some plastic bag over there so that it can't wet, and so that we can avoid the infection. If you see any blood or drainage from your wound, and you just call 811, so you can come easily in the emergency. So the third one is you have to eat some vitamin C and fruits and protein so that your wound get heal easily and you get immunity. And this is all about the teachings. If you have any problem, so just let us know. I will come back after 30 minutes so that I can see whatever the things are going on. Now I'm going to break off on and take the bed on the comfortable position of the patient, and the railing are down and the curtains. So, and there is a call bell inside you. So now I'm going to, are you okay, Mrs. Smith, if I'm good with the railing up? She said yes. Okay, and everything is good. If you have any problem, just this is a call bell, you can call us. Okay, thank you so much. Now I'm going back and taking my supplies with me and all the garbage and my sanitizer and my bottle. So now I'm going to document after everything what I did, and coming back to the room. After coming to the room, I have to hand sanitizer first for 30 seconds, and now I'm going to do all the documents what I did. This is all about my presentation. Thank you.